All right, thank you for joining us today, everyone, for our COVID-19 update. We're going to start with the presentation and then we'll go into the brief Q&A section. Joining us today is Scott Bookman, COVID-19 Incident Commander, Scott Sherman, Brigadier General, Colorado National Guard Director, UCC Vaccine Joint Task Force, and Dr. Eric Brandtz, Chief Medical Officer for CDPHE. And we are going to start with Director Bookman.
Thank you, Heidi, and thank you all for joining us here today to give you an update on COVID-19 in the state of Colorado. As we've discussed several times over the last few days and last week, we are seeing what appears to be the beginning of a fourth wave of COVID-19 in Colorado. We are seeing case rates go up. We reported more than 2,000 cases yesterday alone. Percent positivity is going up. Hospitalizations are also going up. And so while we are moving towards the light at the end of the tunnel, as our vaccine campaign continues to increase, and as more Coloradans receive this life-changing vaccine, it is important for all Coloradans to understand that we do still have a significant amount of COVID in our state, and it's important to continue to take these precautions around this pandemic until people are fully vaccinated. And so a message that I really want to get across today is the importance of continued testing. And, you know, as we've seen vaccine rates go up, in some areas, we've started to see testing numbers go down. And we really want to reinforce the message today that, you know, as people are waiting their turn to get this vaccine, and as some of our restrictions began to relax, it is really important to know that testing can help slow the spread of this virus as we continue to work on our vaccine campaign. Next slide, please. So, you know, when should someone get tested? And at this point, anybody who has symptoms should go get tested immediately and then isolate while you wait for your test results and then continue to isolate if you test positive. So the symptoms that you're looking for that should make you go get tested are fever and chills, cough, shortness of breath, fatigue, muscle or body aches, congestion, runny nose, and then nausea, vomiting, diarrhea. It is really important for people to be attuned to this, and when in doubt, go get a COVID test. Next slide, please. If you don't have symptoms, it may still be important for you to go get tested. So if you have been exposed to somebody with COVID-19 or exposed to somebody who was showing symptoms of COVID-19 but has not yet received their test back, you should quarantine, monitor yourself for symptoms, and then 5 days after your exposure, you should go get yourself tested and then continue to quarantine yourself until you receive the results of this. These simple efforts at testing is what will allow us to continue to control the spread of this disease so we can move forward while our vaccine rates continue to increase. Next slide. So, testing is something that we have scaled dramatically in the state of Colorado over the course of our response. And today there are more than 80 free state-sponsored community testing sites where people who are symptomatic or asymptomatic can go get a free test. They are located throughout the state of Colorado. They are easy, they are efficient, and they are free. So anybody who feels like they need a test for any of the reasons I just discussed, we would encourage people to go to our COVID-19 website, look for the testing page, and find out where the closest testing site to them is so they can go ahead and get tested to help us slow the spread of this virus over the coming days and weeks. I will turn it over to, oh, do I have one more slide? Sorry. We are also working through expanding our Binax at Home rapid testing program. So for any frontline workers, so that's anybody who has to interact with the public due to the work that they do, now have access to for free, our Binax at Home rapid testing program. So if you fall into that category, we would encourage you again to go to our website, enroll in this testing program so that you have the ability to keep yourself your loved ones, and the public safe as you do your critical work to interact with the public every single day. Now, I will turn it over to our Chief Medical Officer, Dr. France.
Thank you, Director Bookman. And good morning, everybody. I'm Eric France, the Chief Medical Officer here for the Department of Public Health and Environment. And I'd like to give you a brief update on the ACIP meeting that occurred yesterday, reviewing the safety of the Johnson & Johnson vaccine. As you know, we awoke on Wednesday morning to hear of 6 cases of a rare blood clot and low platelet disorder among persons who had been recently vaccinated with the J&J vaccine. The ACIP met yesterday to review these cases and to plan their next steps. I think what was interesting in that presentation yesterday was that they did identify that the cases themselves seem to be occurring at a rate that at first blush is higher than what would be expected. So more work needs to be done to really nail this down. I liken this to an experience we could have if we drove from here to Durango and saw a number of herds of elk and thought, I wonder if we have more elk in the state of Colorado these days. The first look suggests we have more elk, but it could be more coincidence as well. So you have to do more research, and that's what's happening now at this ACIP. They'll meet again in a week, probably next Thursday or Friday, look at more data. Over the next days and this week, we expect that there'll be other cases of thrombocytopenia, low platelet counts with blood clots that will be reported to the CDC, and that will inform their work in making decisions. From a policy perspective, they really have 3 different approaches to consider. One is to continue with the J&J vaccine as we have been. The second is to decide to not recommend the J&J vaccine to be used. And the third might be to make recommendations that would vary by age or by gender. Remember, these were 6 women that were suffering these blood clots. And so it could be that only women might be excluded going forward, or of a certain age might be excluded going forward. To do that kind of decision-making really requires more work. The ACIP will review their data, they'll look at age-based and potential gender-based recommendations, and we'll hear more, I hope, in the next 7 to 10 days as they've collected this data. Again, everything is working as expected in the sense that our oversight safety programs have identified something that could be a coincidence or it could be associated with vaccination. There was a pause placed on the use of this vaccine until more research could be done so that we can understand if indeed this is an association. And that work is underway as we speak. So I'm feeling confident that we have the right oversight methods for these programs. It's important to remember too that COVID disease itself is commonly causing clotting disease, and these clotting events are very, very rare. So we will learn more about the risk of these events and how they compare to our regular risks with COVID, and will help us understand whether we need to include that or limit this for vaccination going forward. With that, I'll turn it to Brigadier General Sherman for updates on vaccine supply.
All right. Hey, thanks, Dr. France. Good morning, everybody. Just giving you a quick update here on vaccine distribution. You'll see here over 2 million Pfizer, almost 1.9 million Moderna, and 279,500 of the Johnson & Johnson, the Janssen vaccine. So cumulative doses distributed so far, almost 4.2 million doses, and that's continuing to increase this week as we get shipments. And then cumulative doses administered as of last night, almost 3.6 million doses administered. Next slide, please. Just want to give you, show you how we have a trend line continuing to increase really efficiency, and also bringing the 6 community vaccination sites online. You'll see that last week we had our 2 biggest days, Thursday and Friday of last week, over 75,000 doses administered in a day. And really showing that the efficiency both from our providers and our community vaccination sites on getting vaccinations to Coloradans, and over 400,000 administered last week. So continue to do great. Next slide. I hand it over to Heidi.
Great, thank you all so much for the wonderful information. Now we're going to move to our Q&A portion of this event that we're doing, and how we're going to do this is we'll use the raise hand function. So if you have a question, go ahead and use the raise hand function. I'll call on you if you could say your name and which outlet you're with, and then ask a question. We kindly ask that you stick to maybe one question for this first go round, just so that I can get through as many of you as I can, and then we can go to second round. If there's anything that we are unable to get to today, we will send that over to media_info@state.co.us. And then I believe I want to start with Megan. She is on the phone. Meg, are you able to unmute yourself?
Okay, can you hear me now?
Yes, we can hear you. Excellent.
All right, great. My question is looking at the projections for the fourth wave. It shows that raising the lifting restrictions now versus a month from now could make a dramatic difference in terms of hospitalizations and deaths. Other than encouraging people to get tested and get vaccinated, what else are you doing to try to mitigate that?
Well, we're certainly encouraging people to continue wearing masks, staying 6 feet apart, and asking people that while we open things up, we have to also continue our behaviors that reduce the spread. And of course, in other settings, we'll still be expecting mask use as well. We'll be watching very closely to see what cases do and how that impacts hospitalization rates.
Thank you.
Great, thank you. We'll go ahead and go over to Seth.
Thanks, Seth Klayman at the Gazette. So you guys talked a little bit about testing going down. Beyond increased immunity, why do you think testing has gone down to the degree it is? Is it there are more asymptomatic cases because the case is skewing younger? What do you think is playing a role there?
Well, testing numbers do tend to go down when there are lower number of cases. So, we saw several weeks ago as case counts were still low, there just wasn't as much demand. We are seeing demand increase now as there are more cases across the state. It tends to be a cycle that builds. I think the message that I want to get across today is that while we are making a lot of progress here and more Coloradans are getting vaccinated every day, we are not done with this pandemic yet. And testing is one of the absolutely critical pillars of our response. It's critical to keeping everyone safe. And so we really just want to make sure that those who have not been vaccinated yet, those who are either symptomatic or have been exposed to somebody who is symptomatic, really do continue to quarantine themselves and get themselves tested and find out what their results are.
I might add that as we've worked hard to vaccinate the older Coloradans, people 50 and older, we know that as you age, you are more likely to be symptomatic with COVID. And so now the populations that need to be vaccinated are the younger adults. And it may be that while COVID is spreading, this is a population that has higher rates of asymptomatic spread and may be unaware that they actually have it, which is all the more reason that those who do feel sick need to be tested, because it allows us to identify the asymptomatic that they were in contact with and ask them to quarantine.
Great, thank you. And Nusha, we'll go over to you.
This is Anusha with 9 News. Actually, a follow-up to the testing questions. Because the CDC guidance around those who are fully vaccinated and when you need to get tested has changed, will the state eventually separate out data of who is testing positive that's not vaccinated versus those who have received their shots?
At this point, we are really continuing to look at all the data that we have available. Obviously, we're trying to understand those who have been vaccinated versus those who have not been vaccinated, and any cases of breakthrough virus that we see. And so as we gather more information about that, we will certainly share that.
Great, thank you. Blair, we'll go to you.
Hey, it's Blair Miller with Denver 7. I'm wondering what the biggest driving force was behind choosing this April 16th date to roll over local control, especially as we've seen the cases and hospitalizations rise over the past couple of weeks. And how concerned are you all that we're going to have to roll back restrictions here in another 3 or 4 weeks, as some of these counties have said they have this 30-day monitoring period?
Well, I think it's important to recognize here that what we're doing is working with our local governments, our county officials, our local public health partners to take a localized approach to this pandemic at this point. We see variable case rates across the state. We want to make sure that the orders that are in place are really the appropriate orders for the disease transmission in that particular county. The state will be providing oversight, will be assessing hospital capacity. We continue to see vaccine rates go up. And so, the timing is right to really transition this to localized control, still with the state framework around it.
Great, thank you. Taylor, we're going to go to you.
Hi, Taylor Summers for NBC News Radio. Dr. France, when we're evaluating the clotting risk here with the J&J vaccine, I was curious, is there any kind of comparable medication that may have a similar kind of risk, maybe something that we're maybe more familiar with, or is it just too early to say when we're talking about something that's still so new like the J&J vaccine?
I can't think of anything that is similar in this regard.
Okay, thank you. Natalie, I think you are next.
I hope that's me. I'm Natalia Navarro with Colorado
Yes.
Public Radio. How does the state regularly monitor vaccine clinics like the Dr. Moma's Health and Wellness Center in Colorado Springs? There were supposedly some problems with that clinic with how the vaccine was stored. So I'm wondering, how does the state find out that there are problems at places like this unless people complain? And is there a chance of this happening elsewhere?
So the enrollment process to become a COVID vaccine provider requires all of our medical professionals to attest to the fact they can meet incredibly high standards around safely storing this vaccine, appropriately administering it, and ensuring that it is documented appropriately. You have to be a medical provider, a doctor, a nurse practitioner in good standing with the state, have an active license, and really, commit to being our partner in this process. We monitor social media. We work with our local public health to ensure that anytime we hear any concerns, we do an immediate investigation. We are obviously incredibly disappointed that this happened, and we are working on increasing our capacity, and we'll be going out, we'll be doing on-site inspections to ensure that to the best of our ability that this does not happen again.
So there's other investigations or inspections happening at other places to make sure that this isn't happening elsewhere? Is that what I understand?
We are going to begin doing on-site inspections of providers to ensure that they have the appropriate equipment on site, that they have the temperature logging, and ensure that they are adhering to the practices and principles that they attested that they would do.
Okay, got it. Thank you.
Great, thank you, Natalia. Thank you. Now we're going to go to Jaleesa.
Jaleesa Rosari with 9 News. We've gotten a couple reports of people getting 2 different vaccine doses, like the Pfizer, the first shot, and the Moderna, the second. Is this something CDPHE is monitoring or keeping track of? Does it need to be reported?
We are monitoring anything that has happened out of the ordinary, and we certainly want to encourage all Coloradans to let us know if they feel like something irregular has occurred. We have our COVID concerns email. We have our hotline where you can call and things can be logged. Any adverse events go into the VAERS system. It also goes into CIS. If we see any type of pattern with any provider, we would certainly go out, have a conversation with them, try to understand what's happening.
Great, thank you. Chelsea, let's go to you.
Hi there, Chelsea Brensel with CareDio in Colorado Springs. Just a follow-up question to that Dr. MoMA situation. According to the state's website, it says that CDPHE, part of the requirements to become a vaccine provider is a compliant site visit conducted by the state. Did that happen at the MoMA clinic here in Colorado Springs before they were given vaccines?
So this is an active investigation, and we're still trying to understand everything that led up to this moment. We're obviously onboarding a huge amount of providers to partner with us to meet the task of this mass vaccine campaign. It is in the responsibility of the provider to adhere to all of the guidelines that are set forth. To make sure that they have the equipment on site that they said that they had on site and that it's in working order.
But did the state follow its own policy in inspecting Dr. MoMA's clinic?
This is an active investigation. I don't have that information at this time.
Great, thank you. We'll go ahead and go to John.
Hi, everyone. Yes, John Ingold from the Colorado Sun. Just going back to the dial questions, I'm just wondering, the modeling report that came out this week shows that by ending the dial, if the B117 variant becomes dominant, if there's any sort of moderate reduction in personal behavior that protects against spread, we could end up seeing hundreds of more deaths than we would on the current trajectory. And I'm just wondering, how was that information factored into decisions about what to do with the dial? Why did that not sort of raise more red flags about this looming end date?
Well, I think the factors that we had in mind were, one, the potential for increased cases, balanced by the strong work to get everybody vaccinated. We expect B117 to be reduced, and that people who are vaccinated will have very low rates of infection. The B117 is susceptible and responsive to vaccination. And third, we're looking at our hospitalization rates and even more importantly, the capacity to manage people who are hospitalized. So the scenario was we had those most at risk for hospitalization and death, people 60 and over with high rates of vaccination. We had persistent and growing numbers of vaccination programs in place so that the population will be protected. We had low rates of growth of SARS-CoV-2 infection in the state. And we had a strong desire by communities to be open, to have economic opportunity, and variation across counties, with some places having very low to no cases and others with higher rates. And so how do you solve for all of that? And the decision was that local control with the dial would be the best approach forward, knowing that we have adequate hospital capacity and increasing vaccination rates and high variability across the counties.
Great, thank you. And Megan Hiller, I believe that you couldn't find so I'm going to go ahead and let you go next.
Thank you so much. This is Megan from KKTV in Colorado Springs. Just a follow up on the Dr. MoMA clinic. I was just wondering what's kind of being done to maybe instill confidence in people in the vaccine system here in the state after the MoMA fiasco, and like what is being done to do the people right that have been vaccinated there and have to get at least one more dose of the vaccine or revaccinated there, or not there, but a different place?
Well, I want to start by, reminding everyone that we have administered millions of doses of the COVID vaccine in Colorado at this point, and this is an incredibly isolated incident. It is disappointing, it is concerning. Our heart goes out to those who received vaccine at this clinic. We will be working with them in communication to ensure that they have an opportunity to get the dosing that they need to get them back on track. Again, this is an isolated incident in a very large mass vaccination campaign. We are continuing to work with all of our providers. We have regular contact with them through our Provider Relations and Accountability Center. It's weekly contact from our team with all of our providers, troubleshooting with them. And so this campaign is safe. This vaccine is safe and effective. We just want to continue to encourage Coloradans that when it's their turn, please go get your vaccine so we can end this pandemic and move forward with our lives.
Great, thank you. And then Grant Stringer, I'm going to go to you next.
Awesome. Thanks so much, folks. It's Grant Stringer from the Aurora Sentinel. So I just read a story from the Associated Press. They're reporting that nationally, people largely don't have the willpower to abide by more stringent pandemic restrictions. And now that's shaping policy across the country. So my question was, to what extent was that reality a factor in the state's recent local control decision?
Our decision making here has really been about the importance of local control within Colorado and the need for individual communities to look at their disease rates and put the necessary public health restrictions in place to control disease in their community. There is no one-size-fits-all approach for a state as diverse as Colorado. And so we really just wanted to make sure that we had local control here, the appropriate level of state support. The dial doesn't go away. That framework still exists. It's there for our local public health and our local communities to use to ensure that they can keep everyone safe, that they can, and make sure disease rates stay low.
So that wasn't a factor at all in this decision?
I think we take a number of things into consideration. Obviously, we know that everyone is getting tired of this pandemic. We're all tired of the pandemic. There is a light at the end of the tunnel here. Our vaccination rates are continuing to go up. Vaccine supply continues to go up. The effectiveness of this vaccine is really quite remarkable. You can see the data in cases in our long-term care facilities and how much they have gone down. So, at this point, we really just want to encourage all Coloradans, regardless of, the dial or regardless of what restrictions might be in place, wear a mask. Keep your distancing, stay home when you're sick. We are so close to the end here. It is absolutely critical that we keep following this guidance until the end.
I might add that if anything, the good behavior of Coloradans who are wearing masks, who are staying distant and have done so over the last 15 months, makes it easier to turn control over locally because compared to other states and stories we hear time and time again, I feel that the people of Colorado have been really good about doing what's right to reduce the spread of this virus. And so, if anything, I'd say that knowing how good Coloradans behave makes it that much easier to feel confident that local control will be successful.
Great, thank you. Seth, we'll go ahead and take yours.
Thank you. Similar question, similar vein. So Denver and a number of neighboring counties have said they're planning on moving down into level blue. Looking at Denver's metrics, it looks like we should be pretty squarely in level yellow. So as as counties get control and start implementing their own orders, will the state have any ability to kind of say, okay, that's maybe a little too far, you should go here, something like that, or is it really going to be truly up to counties to make that decision totally for themselves?
Yeah, I think at this point it is county level decision making. As we heard the other day at the governor's press conference from Dr. Douglas, there'll be some metrics around hospitalization that they will use to drive their decisions about their levels going forward. I would imagine that if cases and hospitals became full because of cases and there was risk of overwhelming hospitals again, then certainly the state would be looking at that and considering intervening to protect our hospital systems.
Great, thank you. I think we are out of time for today. If we did not get to your question, please send that over to media_info@state.co.us and we'll work on getting you an answer. And I want to say thank you to all of you for joining us, as well as to our presenters and our interpreters. We appreciate your time today, and we will see you for the next one. Thank you.